Well, November is Men's Health Awareness Month, also known as Movember.
Yeah, it's back. Remember, we used to grow the mustaches and beards.
Movember, Movember.
Yeah, I try to give you a little extra reason to talk about it. Anyway, it is a global movement. On average, men live 5 years less than women. More than 12% of men over 18 are in fair or poor health. Haley's here with more on what doctors want us guys to know.
Right, because men are 24% less likely than women to have visited a doctor within the last year and tend to engage in risky activities that threaten their health. So let's take a look at what men need to know about staying healthy. First, let's go back to that mental health slide. Mental health, according to Movember US, men are not openly discussing their health and how they're feeling. This is why it can lead to reluctance to even talk about your physical or mental unwellness. Now let's talk about suicide prevention, because stigma surrounding mental health simply means that suicide prevention needs to be on your radar for the men in your life. Now let's talk about heart disease, because this is the leading cause of death among men in the U.S. The American Heart Association says tame your stress, watch your weight, and don't ignore snoring. As we know, snoring can be an indication of sleep apnea, which can be dangerous for your health. Prostate cancer and screening for prostate cancer should begin at 40 years old for men with a high risk and 50 for those with an average risk. I spoke with a urologist from Houston Metro Urology about prostate cancer.
If the man has a father, a son, an uncle, a brother that has had prostate cancer, that makes them high risk. Also, if they are of African American descent, or also if there is any germline mutation like BRCA, then they are considered high risk for prostate cancer, and I would encourage them to come in and get evaluated and screened for prostate cancer starting at the age of 40 years old.
But is it true that if the PSA increases dramatically from one test to the next test, that could also indicate that something's wrong, even if the number isn't that magical number indicating cancer?
Absolutely, yes. So the PSA could be low, but as urologists, we tend to trend the PSA and make sure that it kind of stays in line. But if, like you said, if there's a quick rise in the PSA, then it would definitely make us suspicious and want to, evaluate prostate cancer.
Yeah, so don't get too hung up on the number.
Yes.
We're looking at the trend.
Absolutely.
Now, testicular cancer, on the other hand, according to the American Cancer Society, when it comes to testicular cancer, the average age of males is about 33. This is largely a disease of young and middle-aged men, and the symptoms for this include a lump or swelling in either testicle, a feeling of heaviness, a dull ache in the lower belly or groin, or tenderness of the breast tissue and back pain. Those can all be symptoms of testicular cancer.
Those are all good reasons to go to the doctor and ask. This is something that came up on a social media feed that I thought, wait a minute, this falls in that category of, oh, it is maybe true, maybe not. I got to ask Haley. For guys, can we take a pregnancy test to give us some insight into whether we have testicular cancer?
Yes, that's true. So a home pregnancy test can detect cancer in men, testicular cancer, because it can have that hormone HCG, which is what's detected for a woman in a pregnancy. That can be elevated during testicular cancer, but doctors say this isn't a test that we can rely on. It can give false positives, false negatives, so ultimately you got to go to the doctor. I know men are looking for an excuse not to go to the doctor, but after all that, I hope
I saw this, I was like, great, we can just do it. No, you got to
still go.
follow up. Thank you, Haley.
But interesting, right?
So interesting.
Yes.
Haley, thank you. Well,